just like if you're, does anyone play archery? Anyone do archery here? Yeah?
Yeah,
A couple of archers here. Great. So if you're getting everything all lined up, can you stand up and show us how you line up here? Well, you don't have to shoot at me.
But usually like this.
Right. And so then, how far away is the target?
Like 15, 20 feet.
15 or 20
Usually
feet?
A little bit more.
Uh-huh. So, like, if you did like a ½ inch off to start, how far off will it be in the
Well, if you're just a ½ inch, it usually increases the distance it is. So it'll be like a few, like 5, 10 inches. So
5 or 10 inches? Yeah. So it's very similar. If you don't take action now, it can get worse and worse and worse in the future. And so, did everyone see the redheaded woman in this
Yes.
initial segment? Well, she came in. She was like 24. And she was totally debilitated. She had been at UC Berkeley in graduate school, and her girlfriend was taking care of her. It was like 24/7 she had to take care of her. She slept all the time. She didn't get peaceful sleep. Her memory was horrible. She couldn't concentrate, so she couldn't stay in school. And so I went through a process, something like this, actually looking at all 12 of these different factors. And no, she didn't have Alzheimer's or dementia, but it was really like it because she couldn't focus, she couldn't remember things. Essentially, her family was paying for her care, and she was very young. And Alzheimer's and dementia typically is a longer process. It could be 20, 25 years before you start to see it. You know, you shoot the arrow, and then eventually it gets so far off, and you can start to notice it. And so for her, it actually was so transformative that I worked with her doing clearing of toxins from her system, and also working with the meninges, which I'll talk a little bit more about. And because the meninges control all the blood and cerebral spinal fluid flow to the brain and the spinal cord, if that's twisted or torqued, it is cutting off the flow. And it also can cause an over-irritation of the nervous system, so you feel very fatigued. Now, I know that we have one child here.
What?
Here, Ava? What's her name?
My baby's name is Arya.
Aria, sorry. So, not sorry that her name's Aria, just sorry I
Yeah.
didn't remember her name. Does Aria ever like tug on you
Mm-hmm.
and say, you know, hey, I want something or whatever?
Yeah.
And if she did that all day,
Mm-hmm.
how would you feel?
No irritated.
It'd drive you like kind of crazy, right?
Yeah.
Yeah. And if when the meninges, anyone ever done scuba diving? Yeah, we have some scuba divers, okay. And so you know what a wetsuit is? What's a wetsuit?
Like a really waterproof kind of, I don't know. Insulated.
Uh-huh. It's sort of waterproof, right? But but unless it's a dry suit, a wetsuit actually keeps seaweed and rocks and sharks, hopefully, out from getting to your skin. But a little bit of water actually percolates through. And so the meninges are sort of like that. It's like 3 layers of saran wrap. I think I have my little brain thing over here. It's the meninges. Anyone has heard of the meninges before?
Yeah.
What I did with that? Maybe it's out in the car. Oh well. It's like 3 layers of saran wrap that surround and go into every little nook and cranny of the brain. And all the nerves that come out of the brain, people have heard of the 12 cranial nerves? So there's nerves that come out of the brainstem. And it's like vision, smell, hearing, our facial movements, the movement of our eyes. And there's one called the vagus nerve, which goes down, it actually goes out of the skull, and it goes down, has a lot to do with stress. And the stress reaction.
That again. Another one.
So surrounding even those cranial nerves is the meninges. It's sort of like a sleeve. And if that sleeve got twisted or torqued, and as the body's moving, it could irritate it and cause it to fire. And so if there's meningeal compression, which was the case with that patient, then the vagus nerve is firing off so much, there's this constant stress on the nervous system, so it's a constant stress response, not because of the environment. Not that UC Berkeley is not maybe academically challenging, but it's because her nervous system was constantly being irritated by the tightness around the nerves. And so opening that up and getting that released not only allowed circulation of blood and oxygen. Do you think maybe blood and oxygen is necessary for the brain to work? Yeah, for sure. For sure. Yeah, I mean, you know, those nooses around the neck, those don't work very well.
So that's why she had the headaches, because the lack of oxygen?
There was a lack of oxygen, lack of circulation to the nervous system itself. And it's sort of like a contained, the meninges surround the brain, the spinal cord, and there's cerebral spinal fluid that just flows in there. We have a lot of different fluids. What are some fluids the body has? Just name off some.
Saliva.
Saliva, great.
Pee.
Pee, good.
Blood.
Blood,
Cerebral spinal.
cerebral spinal fluid, sweat,
Tears.
yeah, tears, exactly. There's all kinds
Digestive
of
juices.
digestive juices, exactly. So there's all these different kinds of fluids that our body produces, and they're specific to a particular area. Like hopefully this spit isn't like coming out of our skin here, right? Or we don't cry tears out of our feet. And so the cerebral spinal fluid is specific to the cerebrum, the brain up here, and the spinal cord. Now, how many people ever? Anyone know the Warriors? The Warriors? Or Steve Carr?
Yeah.
Right? And what was his problem? What was he having?
Headaches.
Headaches, really debilitating headaches. And why? Did you ever hear why that was happening? He had a spinal tap, and a spinal tap goes through the meninges into the cerebral spinal fluid. And sometimes, because that's a big like hole, it can leak out. Just like if you have your blood drawn, sometimes blood comes out and it's bruises. Well, it's sort of like that. But the meninges are a closed system, usually, unless you stick a hole in it. And he was having leakage of cerebral spinal fluid, and that was causing his headaches. So the meninges are really a very important structure that are not really looked at by most physicians or others. But anyway, that's one of the key factors in this whole process here, that if it's not working right, you don't get the blood flow to your brain, and there's immunological factors in the cerebral spinal fluid that help keep your brain from getting infected or inflamed. So I'm sorry, I did have my brain somewhere.
So, can I ask you a question?
Brain, I could have shown
That doesn't sound good.
I love that little thing here.
Even though you don't have your brain,
Yes.
I wonder if you can tell me when they talk about the blood-brain barrier.
Yes.
What is that?
Yes, exactly. So we were talking about the scuba diving outfit, like a wetsuit. And so a wetsuit is this barrier, but it allows some things to percolate in. And so the blood-brain barrier, the meninges are the blood-brain barrier.
Oh.
It's like saran wrap, but it's porous. So it allows certain things to go in and allows certain things to come out.
So certain medications do not cross the blood-brain.
That's exactly right. And there are a lot of chemicals that don't either.
This one does, frankincense.
Oh.
And another thing is that many people, everyone's heard of the biome, microbiome, like in the gut and everything. So 70% of our immune system is in our gut. 70%. And if the critters in there are not in balance, there can be certain ones that are pathological, like Giardia. Anyone know some other names of bad critters in the gut?
Oh, candida.
Candida.
E. coli.
Parasites.
What?
E. coli.
Yeah, E. coli parasites. Good. So when those get out of balance, each of them has signature chemicals that they produce. Just like are you turn a couple? You're a couple?
Sort of, who, us?
Yeah. or
Sort of,
somebody.
yeah.
So perhaps each of you has your own unique bouquet, right? So we each have our own certain chemistry that we produce. We produce certain chemicals, and so do little bacteria. So the bacteria, if they're out of proportion, they can be leaking chemicals into the gut, and then that goes into the bloodstream, and that can cross the blood-brain barrier. And so certain species, if it's too much in the gut, produces chemicals that stop the breakdown of dopamine. Everyone's heard of dopamine? Yeah, or serotonin?
Yeah.
Good. GABA? It's another one of the neurotransmitters. So dopamine and serotonin are like feel-good chemicals. And so, but you can't have too much in the brain. If you have too much of one and not enough of another, there's things are thrown off and behavior gets like, it alters. And the function of the body alters. So one of the Clostridia species, to get really specific, produces chemicals that go up into the brain, and it influences the enzyme that breaks down dopamine. So we have to have dopamine built, and we have to have it taken apart, so we don't get too much. And so it alters the breakdown of dopamine, so you get way too much dopamine in the brain, and it gets imbalanced. So a lot of behavior and ideation and things like that can get altered just because of the little things in your gut. So that's brain being influenced by the gut too. So the blood-brain barrier is the blood going in and being influenced by the brain, but there's also the gut-brain connection too that has to be looked at. And so anyone who's having these issues, like that patient, we look at the gut, we look at food allergies, could be an influence. That's another one on there. Look at the meninges. So we did meningeal adjustment in order to get things working better. And it was really exciting to be able to help her. She was able to, after, 3 or 4 months, she was feeling so much better. She was able to re-enroll at Berkeley. Her parents she didn't have to borrow money from all her family just to eat. And so this huge transformation. So it is possible that the brain can have negative influences and have like a dementia-like situation, even though you are in your 70s or your 80s. It can occur very early. And so it's a little different from early onset dementia, or Alzheimer's, but it's pretty close to it. Pretty close to it. So one of the things I'd like to also do now, if it's okay,